The less you use something, the less it wears out. Makes sense, right? But this logic doesn't work for joints. Joints wear out even when you're sitting and doing nothing. And the less you move, the faster your joints age. Suddenly, climbing stairs becomes a challenge, and everything hurts, even when you're completely still. So why do your joints ache at rest? And what can you apply or take to move at 60 like you did at 30? We'll cover this in our video. How to stop age-related changes in cartilage. What helps keep joints flexible? How to relieve pain without painkillers. What remedy helps you move and feel like you're 30 at 60? Do joints need cold or warmth? What do popping and cracking in joints mean? How can you restore your joints? And beyond this valuable information, I'll share a recipe for restoring cartilage using water and 2 teaspoons of a product everyone knows. Did you know that joints are the connections between bones that allow us to move? Joints are both complex and simple. Bones are capped with softer cartilage. In between them lies a fluid, lubrication that resembles egg whites. This lubrication helps cartilage reduce friction between bones and absorb shocks. If there's not enough lubrication, like when joints are overworked, pain is inevitable. Pain is a clear sign of joint dysfunction, which in older people is often linked to age-related changes in cartilage, inflammation, insufficient lubrication, or excessive viscosity. But before we dive into the symptoms of age-related changes and treatment methods, let's learn how to handle pain. Our experts today are Dr. Pavel Borisovich Ocheritin, a rehabilitation medicine specialist, Dr. Irina Gennadievna Ocheritina, a trauma orthopedist, myotherapist, and PhD. There are different approaches. Pain is a signal from your body. When pain occurs, there's no need to quickly suppress it, especially with medication. Acute pain sometimes requires medication to ease the pain, so the patient can visit a doctor who will find and address the root cause. However, if we must choose between anti-inflammatory drugs and anti-inflammatory exercises, I would definitely recommend exercises. We know which exercises can be effective for acute pain in any joint. Therefore, when choosing a treatment approach, always prioritize eco-friendly methods and seek doctors knowledgeable in these techniques. First, minimize the load on the joint temporarily. Do not attempt to treat an aching joint with additional strain, such as walking. Second, release the trigger points causing muscle clamps that compress the joint. Third, adjust your diet and maintain proper hydration. Fourth, select anti-inflammatory drainage exercises. If your joints are bothering you, we recommend temporarily giving up coffee. Caffeine narrows blood vessels, which can lead to spasms and increased pain. Instead of coffee, opt for herbal tea with ginger. So, how can you ease joint pain without medication? When pain arises, it's a signal and a call to action. Medications can only alleviate inflammation and slightly mute it. But with exercises, we can relieve the joint, restore tissues that currently act as harmful clamps, and halt the process of cartilage destruction. There is a vast range of exercises designed to manage pain without the need for medication. Thank you for the clarification. When you're in pain, you want to relieve it effectively, not just for a day, but permanently. And to do that, you need to understand the cause of the pain. After all, there are over 100 different joint diseases: osteoarthritis, arthritis, rheumatoid arthritis, bursitis. These are the most common, especially in older adults. So let's figure out what causes pain. Joint pain isn't always due to cartilage wear or lack of lubrication. For example, joint pain throughout the body is characteristic of rheumatism. A person feels pain in the hands, legs, knees, elbows, moving from one place to another. With rheumatoid arthritis, however, the pain is symmetrical. Both wrists, both feet, or both knees hurt equally. This is a hallmark of the disease. People often say they're suffering from rheumatism when their joints are inflamed and painful. But rheumatism refers to a wide range of diseases that affect the joints, muscles, bones, and ligaments. Rheumatic joint pain isn't just caused by inflammation or injuries, but also by immune system disorders. Rheumatoid arthritis is a condition where the immune system attacks the joints, causing inflammation, pain, and deformity. Do your joints ache or feel twisted when the weather changes? If yes, hit the like button. The exact mechanism behind weather-related joint pain is still unclear. Researchers suggest that increased atmospheric pressure can raise the volume of joint fluid. This fluid presses on nerve receptors, causing discomfort, pain, and other unpleasant sensations. However, the exact causes of weather-related joint pain remain unknown. What's clear is why joints ache in cold weather. In the cold, the body prioritizes warming vital organs like the heart and lungs. As a result, blood flow to the hands and feet decreases, causing them to feel cold. Heat leaves the joints, which can also cause pain and discomfort in the knees and hands, even in healthy individuals. By the way, what do you think? Should an aching joint be warmed or cooled? Options vary online. So what's the right approach? Cold or heat? I asked our expert. When an injury occurs, whether in a joint or elsewhere, the first 24 hours require cold, rest, and fasting. Why do we apply ice? To reduce blood flow and therefore stop swelling and inflammation from progressing. After 24 hours, you can apply warmth and carefully perform physiotherapy procedures prescribed by your doctor. At home, you can use warm compresses, such as those with sea salt, to help alleviate pain. However, if the joint is hot and tests show unfavorable results, under no circumstances should you apply heat using ointments, saunas, or compresses. There's no universal answer since the causes of joint problems vary. For example, in osteoarthritis, the pain results from the loss of cartilage, making the joints stiffer. This often occurs with age or after injuries. In gout, however, joint pain in the big toe is caused by excess uric acid salts. That's why seeing a doctor for an accurate diagnosis and treatment is crucial. For instance, do you know how to distinguish osteoarthritis from arthritis? They're very different conditions. Osteoarthritis is an age-related condition where joint cartilage wears out, while arthritis is a joint inflammation that can occur at any age. Only a doctor can 100% differentiate between these conditions, and we'll try too. With arthritis, the pain comes on suddenly. It's intense, sharp, and pulsating. It occurs at rest and worsens with movement. The affected area becomes red and swollen. Joint pain from osteoarthritis, on the other hand, occurs after physical activity and disappears at rest. Osteoarthritis develops slowly, with pain emerging only after significant joint damage. With arthritis, stiffness in the affected joint lasts about 20 minutes after resting, after which it loosens up. With osteoarthritis, dull nighttime pain is typical. So, what's more dangerous for your joints? Arthritis or osteoarthritis? Let's hear from Dr. Ocheritin. Arthritis is an acute condition that develops quickly. Joints swell, become hot, and movement is severely limited. Treating arthritis without medication is rarely possible. Arthrosis, on the other hand, is a slow progression of joint aging due to compression. It's best to address it at stages 1 or 2, giving the joint a chance to return to a healthy state. If you ask which is worse, I'd say arthritis. The suffix itis indicates inflammation. Inflammation can have various causes and is usually treated with medication. Imagine you've trapped your finger in a door. Will there be inflammation? Yes. Swelling? Yes. Will the finger change color? Yes. But would you keep the finger stuck in the door and send someone to the pharmacy for medication? No, of course not. You'd have enough sense to open the door. Similarly, with arthritis, you need to release the joint from the clamps compressing it. It's important to understand how to avoid osteoarthritis as we age, and if you already have it, how to stop it from progressing and prevent further joint damage. Let's dive into it right now. There are several causes of joint problems beyond natural aging: injuries, excessive strain, lack of movement, and being overweight. Among these, excess weight is the leading cause. When you stand or walk, every extra kilogram puts additional pressure on your joints. Consider this. If one person weighs 70 kilograms and another weighs 100 kilograms, the heavier person places the equivalent of a 30-kilogram sack of potatoes on their joints when climbing stairs. And if someone runs or jumps at such a weight, their cartilage will suffer the same fate as an egg struck with a hammer. It won't withstand the pressure. Losing just a few kilograms reduces the strain and slows down joint wear. And I have two pieces of good news for you. First, you can lose weight at any age. Second, joints can regenerate, but the sooner you start, the better. So what should you do to restore them? Move. Move? How, you may say, when everything aches and throbs? But movement itself is the medicine. Any activity, from mopping floors to gardening, puts a load on the joints. The knees bear most of this load, followed by the hip and ankle joints. But moving less is the worst decision for painful joints. Why? Because physical activity triggers your body to produce lubrication, which is essential for keeping joints functional. Additionally, movement increases blood flow to the joints, nourishing them with beneficial substances. It also strengthens the muscles and ligaments around the joints, reducing pressure on them and improving mobility. Physical activity doesn't wear out your joints. It protects them from aging. Of course, this is only true if the exercises are chosen wisely and don't overburden you. That's why even with osteoarthritis, the Ministry of Health's clinical guidelines recommend moderate physical activity. Our expert confirms this. A joint affected by arthritis needs rest, while a joint with arthrosis requires movement, but not in the form of walking. Instead, specific beneficial exercises are performed mostly while sitting or lying down, with a large number of repetitions. Ready for a warm-up? Our experts recommend these exercises to maintain joint health. Watch the correct techniques for performing them. Here's a great exercise for knee joints. You'll need a sturdy, high table, and simply swing your legs back and forth for 5 to 10 minutes. Your joints won't be strained, but they'll receive excellent blood circulation. Learn from children. For the right elbow joint, extend your arm to the side, placing it on a door frame with your fingers pointing upward. When shifting your feet, turn away from your right arm, then return to the starting position. Turn your fingers backward. Repeat the process. Then point your fingers downward and repeat. Shake your hand and perform the same exercise for the other arm. Perform these exercises daily and your joints will gradually recover. But remember, exercises alone aren't enough. What else do joints need for recovery? When do joints begin to heal? Joints recover when they are freed from muscle clamps. A compressed joint has almost no chance of becoming healthy. Freedom is key. If you strangle someone, they'll suffocate. Offering them water or an oxygen mask while strangling them is nonsensical. Similarly, if a joint is compressed, it will deteriorate. Joints recover when they are properly nourished. Honey and apple cider vinegar also help restore joint health. Apple cider vinegar contains acetic acid, known for its anti-inflammatory properties, and inflammation is the root cause of rheumatic joint diseases. Meanwhile, honey is rich in calcium, magnesium, and potassium, which are essential for joint health. Mix honey and apple cider vinegar in equal proportions and take 1 tablespoon of this solution in the morning and evening. Aching joint pain can also be relieved with warm baths containing sea salt. The warmth relaxes the muscles around the joints, alleviating tension and spasms that exacerbate joint pain. Additionally, blood vessels dilate, increasing blood flow to the affected joint and delivering oxygen and nutrients. As for sea salt, it has anti-inflammatory properties. When you soak in water with sea salt, beneficial materials penetrate the skin, helping to reduce joint inflammation. Since there are many joint diseases, there are even more treatment methods. Doctors often prescribe medication, physiotherapy, and massages for joint issues. In advanced cases, surgical intervention may be required, including joint replacement. But it's best not to let things get that far. At the first signs of joint problems, you should eliminate excessive strain, which is harmful to joints. What kind of strain are we talking about? Jumping. This always puts excessive pressure on the knees. For the hands, harmful strains include impacts, heavy lifting, and twisting motions, like wringing a cloth. Prolonged static strain, staying in one position for an extended time, is harmful to joints in any location. This is especially damaging when the knees are bent. For instance, if you squat for several minutes, like when working in the garden, you place significant strain on your joints. Don't do that. Even when you're sitting, your knees bear a quarter of your body weight. For example, if you weigh 80 kilograms, your knees experience a load of 20 kilograms. Yes, our knees are arguably the most vulnerable joints in the body. Knee osteoarthritis is one of the most common conditions among older adults. Speaking of knees, have you heard the news? Doctors have learned how to restore knee joints affected by osteoarthritis. At Sechenov University, cartilage cells are taken from a patient, cultivated, and then injected back into the joint as a fluid containing these cells. The cartilage tissue regenerates. Of course, the method is still very new, but it allows knees to be restored for people who were already preparing for joint replacement surgery. For now, this treatment is only available for the knees, but this confirms that cartilage tissue in our bodies can regenerate. It just needs a little help. How? Let's discuss this now. Certain foods can restore and help maintain healthy joints, if they're the right foods. Your plate should include fatty fish like salmon, sardines, mackerel, and cod. These fish are rich in omega-3 fatty acids, which reduce inflammation and strengthen joints. Omega-3 fatty acids act on cartilage, the smooth surfaces in joints that allow them to move effortlessly. Eating foods rich in omega-3 helps your cartilage remain elastic. In addition to fish, include walnuts, almonds, and flax seeds in your diet. These contain essential fatty acids and compounds that prevent joint aging. Blueberries, pomegranates, red peppers, broccoli, and spinach reduce joint inflammation, so they absolutely deserve a place on your table. You can't restore joints without enough protein, which is the body's building block. Eat meat, fish, and eggs, but don't forget about plant-based protein sources like beans and peas. Also, make bone broth more often. Do you like bone broth? Hit like if you do. If not, now's the time to start loving it, as bone broth is packed with collagen, which is essential for joint health. Collagen is the protein that makes up tendons, cartilage, and bones. When there's enough collagen, it cushions impacts and reduces friction in the joints. However, as we age, collagen levels decrease, leading to less joint flexibility. To counter this, eat foods rich in collagen. Aside from bone broth, this includes rich meat stocks, beef, fish, and seafood. But not everyone likes or eats meat or fish. So how can you help your joints then? Eat gelatin. Gelatin is the same beneficial natural protein with water removed. It helps strengthen cartilage and connective tissues. All you need is 2 teaspoons. Here's the recipe. In the evening, mix 2 teaspoons of gelatin with 1/3 cup of cold water and let it swell overnight. In the morning, add warm water to make a full glass and drink it on an empty stomach. That's it. Simple and effective. Drink gelatin water every morning for a month. Then take a month-long break and repeat if necessary. This will nourish your joints with collagen. Of course, you can buy special supplements, but they're expensive, while gelatin is affordable and available in any store. How do you restore your joints? Share your recipes and tips in the comments. I'll tell you how to reduce joint inflammation with food. To reduce joint inflammation, incorporate turmeric, ginger, garlic, and onions into your diet. These ingredients have powerful anti-inflammatory properties. If you eat them regularly, you address the problem from within. But eating a lot of garlic every day might not be practical for everyone. We suggest making a garlic elixir. Peel 4 heads of garlic, mash them into a paste, add the juice of 10 lemons and 2 teaspoons of grated horseradish. Let the elixir steep in the refrigerator, preferably away from light, for 3 weeks. Then dilute 1 teaspoon of the elixir in a glass of water and drink it morning and evening before meals. Simple, isn't it? Some people recommend rubbing garlic into the skin, but I wouldn't risk it. This can cause real burns. The internet is full of advice that can harm blood vessels rather than help them. Now, our expert will reveal the most dangerous advice out there. Some folk remedies can seriously harm our joints. For instance, if a joint is red, hot, and inflamed, so warm you can feel the heat through your jeans, you should never go to a sauna. Many believe a sauna solves all problems, but that's not true. If the joint is inflamed and we further heat it with a sauna or steam bath, it's absolutely contraindicated. For arthritis, a compress made of aloe vera and honey applied overnight helps relieve pain and inflammation. Mix a quarter cup of aloe juice, a quarter cup of honey, and a quarter cup of warm water. Heat the mixture slightly to activate the ingredients, then apply it to the affected joint. Cover with plastic wrap and bandage loosely. Apply these compresses every other day until the pain subsides. This remedy works, unlike the one our expert called the most useless. What is that remedy? Watch the screen. The most useless folk remedy is listening to neighbors' advice. What works for one person might harm another. Don't try on someone else's shoes. As the saying goes, trust the internet, but verify. Take, for example, creaking and cracking in joints. It's bad, the internet yells, but what's the truth? Most people believe that creaking, cracking, or clicking sounds are caused by worn cartilage and a lack of lubrication. And in 3 out of 10 cases, they're right. Do you listen? When there's insufficient joint fluid, joint surfaces rub against each other, cartilage wears out, and you hear creaking or crunching sounds. But such sounds can also occur in healthy joints. When the pressure inside the joint changes, gas bubbles in the joint fluid burst, producing cracking or popping sounds. This is completely normal as long as there's no pain and the joint's mobility isn't restricted. If a joint hurts, doesn't move properly, and makes noises, it's time to see a doctor for a diagnosis and to determine the cause of the creaking. But let's get back to folk remedies that can help with joint pain. Another traditional method for treating joint pain is rubbing with pepper oil. Red pepper has an excellent warming effect, which is why many pharmaceutical joint treatments are based on it. Red pepper contains capsaicin, a compound that does 2 things. First, it blocks pain signals, acting as a natural painkiller, and second, it stimulates blood circulation. Increased blood flow to the affected joint helps reduce inflammation. This is why pepper oil is used for rheumatic joint pain. It's a great alternative to pharmacy medications, and you can make it at home. Here's how. Take 10 fresh red chili peppers, wash and grind them using a meat grinder. Add 2 cups of vegetable oil, any type you prefer. Let the mixture infuse in a dark place for a week. Then strain it and use the oil for rubbing during flare-ups. During these periods, it's also advisable to reduce strain on your joints. How? If your hand joints hurt, avoid carrying or lifting heavy objects. Try not to perform actions that strain your hand joints, such as wringing laundry by hand, kneading dough manually, or pushing doors with an outstretched hand. Use your shoulder instead. If your leg joints, knees, or hips hurt, avoid sudden movements like jumping, jerking, or running. Wear properly sized shoes with low heels, elastic soles, and orthopedic insoles. Good footwear absorbs impact while walking, reducing joint strain. When getting up from a chair or sofa, lean on the armrests to shift some weight onto your hands. If your doctor recommends it, use a cane. Relying on a cane reduces the load on painful leg joints. And don't forget, daily moderate physical activity is beneficial. Walk, swim, or do exercises recommended by our expert. Dr. Oteritin knows exactly what to do to help you move like you're 30 at the age of 60. At 62, I move much better than I did at 30. I bend deeper, my body is more flexible, and I have no pain, unlike when I was in my early 30s. What's the secret? Remove all blockages that prevent your body from functioning well. Adjust your diet, and maintain proper hydration. You can move like a 30-year-old even at 80. In our country, there's a stereotype among doctors. What do you expect? It's your age. Or, what do you expect? It's your weight. I always tell my patients that it's not about age or fat mass. It's about the quality of connective tissue. Why does Eastern medicine emphasize spinal flexibility at any age? Because they understand the spine is the pillar of life. Eastern medicine never blames age or weight. They focus on maintaining spinal flexibility for patients of any age, and I wish the same for all of you. Follow the specialist's advice. Stay active, but avoid overloading your joints. Find a balance between activity and rest, and your joints will stop creaking, aching, and throbbing. If no remedies work and severe pain and joint swelling persist, see a doctor. Remember that joint problems are one of the leading causes of disability and reduced activity worldwide, especially after age 50. Over 350 million people suffer from joint diseases. Cross your name off that list and find out your diagnosis and take care of your joint health. And don't forget to like this video and subscribe to our helpful channel so you won't miss our experts' advice and effective health recipes. Wishing you health and longevity.